Until the pandemic came and hit us, I think a lot of people were not quite so aware as to how much our lives are impacted by global events that might start anywhere.
This is a real crisis.
I mean, it's been clear that this was likely to spread in the U.S.
We need to be thinking much more ambitiously.
Climate finance is a very big issue.
We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
CGD came about because it was time to focus not only on what developing countries should do, but much more on what the rich world should do.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
Some of our previous work has helped to come up with a kind of innovative financing mechanism that was used to help launch pneumococcal vaccines. We really have researchers and experts here at CGD who come at these issues from multiple vantage points, and I think that's just what helps make our research more rigorous, more rich, and actually more connected to the realities that decision makers are grappling with.
We've been looking to CGD for all of your research and analysis to guide us.
So CGD is nonpartisan. Because of that, over the years, that credibility has given us significant convening power.
Our government highly values the work.
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
Every single time that we're able to get it right, it means we're reducing significant poverty.
If you can help to make things a little bit better, that's a good way to spend your time.
Welcome to the Center for Global Development. My name is Javier Guzman. I'm the Director of the Global Health Policy Program. It is a pleasure to host you today to have a conversation on a very important issue for the Americas. On the week of September 26th, countries in the Americas will elect a new director of the Pan American Health Organization. 6 candidates are competing to fill the post held by Dr. Carissa Etienne since 2013. And we do want to talk about the health challenges and the challenges PAHO face in the years to come. On the broad landscape, if we look at context, Latin America has been disproportionately affected by COVID. And we see how 1.7 million people have died in Latin America and the Caribbean. And that means basically over 27% of deaths worldwide. COVID has also shown us that health systems have not been receiving adequate support in the past years. The levels of public spending on health in the region has been far below the 6% recommended by PAHO. There's a very high out-of-pocket expenditure, and clearly, if we look at the economic landscape, it's not very promising. We have, we've had the worst economic downturn in the history in the past couple of years, and even though economies are rebounding, there's unemployment, there is poverty, there is inequity, exclusion. So it's very important for us to talk today about, how the new Director General will face, will tackle these challenges and will take the Pan American Health Organization to a new role within the region and within, the world. So it is a pleasure for me to host very key experts, very important experts from different countries in the region today. The first thing to say is that unfortunately, Dr. Jimena Aguilera, who was going to join today, has not been able to do so. She's been, nominated as the new Chilean Minister of Health, and she had a meeting with the president at this same time and day. So unfortunately, Jimena will not be with us, but we do have Francisco Becerra, former Assistant Director of the Pan American Health Organization. We have Dr. Lucrecia Hernandez, Congresswoman from Guatemala, former Minister of Health. And we have Dr. Fernando Lorca Castro, Ambassador of Costa Rica to the United States and former Minister of Health. So we'll have a few questions to begin with, and then we'll get questions from the audience. The first question to get started today is about the health challenges that we face in the region. We know, PAHO is central to health in the Americas, and I just wanted to ask Ambassador Yorka, what's your overall feeling about the health challenges? What are the priorities? I mean, I mentioned a bit, the economy, I mentioned COVID, I mentioned health systems, but what do you think are the main health challenges facing the region at the moment? Over to you, and welcome to CGD.
Thank you so much. I really want to thank the Center for Global Development for this very important event and bringing this very important topic to the table. We all recognize that PAHO is the most important multilateral health specialized institution in our continent and the Americas, and definitely is one of the most important in the whole world, and it's very important to recognize that. Well, challenges, the list could be a huge list of challenges we are all facing, but from my point of view, in the Americas, one of the most important topic is the epidemiological transition and double burden of diseases we are all facing. And of course, it becomes really hard in low-income countries. That's one of the most important challenges we are still facing, because it's not really new, but we are still dealing with infectious diseases we haven't been able to control in the whole continent, but at the same time we are dealing with severe chronic and severe health problems like cancer and some others related at the same time. Another huge problem we should address is the demographic changes we are all facing. In some countries, these demographic changes are not becoming a real thing so fast, but in some others, our populations are becoming very old ones, and with all the challenges elderly bring us as a whole society. Migration movements, it's definitely something we should mention. We can avoid that, and I will talk about better or to find or to guarantee a good nutrition security for all our people, and not only food security, which is something really different, and we haven't been able to separate those concepts properly. Another are the mental health problems we should realize are there. For example, human behavior is changing, and it's actually affecting us all in a good way, but also in a terrible way for health purposes. And finally, because I don't want to mention all the list all by myself, for example, traffic road accidents. In most of our countries, we must recognize it's actually a real public health problem. And it's linked to mobility challenges we're still facing, and at the same time, the lack of efficient public transport solutions in our countries. Just to mention a few. Javier, I'm also want to thank you for the invitation, and congratulations for a great job, Javier Guzman. Please.
Thank you, Ambassador. Thank you very much. So you mentioned quite a long list, so it's going to be a difficult position that new Director General will be in, trying to tackle all these different challenges. Lucrecia, do you want to go ahead and give us your perspective? I mean, you come from Central America. What is your perspective about the biggest health challenges the region faces?
Well, I think Fernando read my paper because the first challenge that I have here is exactly the complex epidemiological profile of the region. For example, in Guatemala, we have all these the communicable diseases like infant mortality and stunting, but we also have cancer and high blood pressure and diabetes and accidents and violence and addictions and other mental health illnesses, right? So the problem is that the interventions here in Guatemala are still directed basically to maternal and infant health, while the more than half of the budget for health is going to hospitals. So the main challenge for PAHO and the country here is to build a health system that is truly based on comprehensive primary health care, so that it addresses, it has an integral approach and not a fragmented one. And another health challenge that we are facing is that we're in a post-pandemic era. So we must think about this moment as an opportunity, because never before in the recent history, societies understood the importance of having a strong public health system. But now we deal with many challenges left by COVID, not only long COVID and the cases and the people that died, but also many other diseases that were unattended. And now we're having this bouncing back effect, like, for example, cancer or TB, or we see a drop in the vaccination coverage. So, and still we don't know if COVID has ended. We don't know what is going to happen with the monkeypox. And we are facing a shortage of food in the near future. So this will definitely impact in the whole region, in the whole world, and the region especially. So I think PAHO is facing hard challenges in terms of, health problems.
Thank you, Lucrecia. And I guess, you've said something that is very important. There is an opportunity now, but there are also competing priorities. So within the region, we see, how, education is also a priority, how, defense is also a priority, migration is also a priority. And I guess health is going to be, a difficult choice to make. And I guess we're here to make the case for investments in health and for highlighting the role of PAHO. Francisco, you were with PAHO, and we want to hear from you. What is the role of PAHO in addressing these challenges? Like, we've heard about, all these different health challenges. Can PAHO really help? Like, what do you think are, the main functions that the organization could play addressing those challenges?
Thank you, Javier. I think that there's a lot of room for PAHO to support countries. Of course, we have to remember that PAHO is geared by all member states in the region. So that's something that we also have to take into consideration. It's not only the Secretariat working, but is working under the mandates of the member states. But also, PAHO has to be on top of all the issues that we can combine of what Lucrecia and Fernando were saying. For instance, all the work on epidemiological outbreaks. For instance, the case of Legionella that is happening right now in Argentina. First, it was a non-known pneumonia. PAHO came in and supported the Ministry of Health. Now they have a diagnosis, and PAHO is supporting with epidemiological tracing and work. So I think that there's always opportunity for PAHO to support countries. Of course, we have health systems and ministries of health that are stronger than others. We have seen during the pandemic the fragility of health systems everywhere. So I think that that's room for PAHO to start working with ministries of health on strengthening health systems, because that, if we don't have strong primary health care, secondary, tertiary care, we're going to be seeing a lot of problems with all the issues that both Fernando and Lucrecia were saying, but also, Javier, colleagues, we have an issue with climate change and all the diseases and affectations to health that climate change is bringing. So we're seeing droughts, we're seeing storms, we're seeing hurricanes that are stronger, and we're seeing a lot of effects on health. But also, among all these things, we have aging. The population in the Americas is aging faster than what Europe aged after the World War II. So are our health systems in the region ready to support that aging process with all the NCDs growing, with all the climate change issues, with all the mobility issues? And I think that PAHO still has a lot of work to do there, but also you cannot address everything at the same time, Javier. So you have to prioritize. And the countries are the ones who prioritize for the budget allocation. So if countries deem aging the first one, more money is going to be going into aging, but this prioritization process is key when the PAHO start working with member states. So what PAHO can do will be geared by member states as the owners and the guides of the organization. So there's room, but also there's possibilities of PAHO joining forces with those countries that are stronger in epidemiological work, that have experience in strengthening their health systems. And I think that they can really work together supporting other countries that are in need of those things or are weaker in their health systems and the Ministry of Health. Also, there's an opportunity, Javier, that hopefully ministries of health understand the need to have a civil servant structure that remains in place, and you don't go changing everybody with every change of Minister of Health. If you keep people trained that can respond to epidemiological threats right away, there will be a culture in the country within the Ministry of Health to face those issues right away and don't start going around what's happening, what's going on, and wait for someone to come and help. And I also think that PAHO will have to, and it's already doing it, it doesn't work the same with all member states. It devotes more time to those member states that are in need or that have more needs than those who are stronger and are better off. So I think that all these issues are important. But something that the pandemic has shown us, colleagues, is that we're going to be seeing a change and a shift in a lot of issues around the managing of healthcare because of long COVID. Physicians are going to be seeing issues that we hadn't seen before. So we're going to see a myriad of syndromes and symptoms that we haven't seen before. How are we going to be treating those? What are going to be the new medications that we're going to be needing and bringing into the healthcare that we usually didn't use before, or we're going to be using more with this new long COVID? But also the pandemic has shown us, besides the fragility of the health system, we also have seen a great impact, negative impact on immunization programs. And I think that that's another issue. If those cohorts that were lost in many countries during the 2 years of the pandemic, and we can see the trends that most of the countries in the region went down in their coverages, there's a lot of catch-up activities for countries to perform in those vaccination groups that didn't get all the vaccines during the 2 years of the pandemic. If we don't work and countries don't work together with PAHO to strengthen immunization programs, we're going to start seeing more and more cases of and outbreaks of measles and other vaccine-preventable diseases. So I think that the mixture after the pandemic is going to be critical in many aspects for ministries of health and PAHO to work in the future.
Thank you, Francisco. I think, yeah, Lucrecia, please go ahead. You wanted to say something.
Yes, I agree that there's a lot of room for PAHO to work, and there's a lot of work to do, right? But I do think that PAHO needs to reclaim its place as a major player in the global health community. I think it has lost a lot of its political capital right now. For example, back in the 80s, PAHO was very well regarded. It was the health authority in the Americas, and it was an important symbol of Pan-Americanism. But then the spotlight was taken by the banks, and then by bilateral agencies, and then by the foundations. And more recently, during the pandemic, we basically turned to national agencies like CDC. And PAHO did lose some of its place as a major player here in the global health and in the pandemic. So also in conservative and polarized political settings like Guatemala, the United Nations agencies are being hardly questioned. So this is something that the new director needs to address. I mean, it has to show strong leadership and not only be like a technical reference for health in the global setting. And also, I think that something that needs to be addressed is the financing. Who is setting the agenda? And it seems like, of course, the country's contributions are not enough for PAHO to work. And so PAHO needs to look for projects and administrate or execute projects from other donors or agencies. But the thing is that it seems like these are the agencies who are setting PAHO's agenda, instead of being the country's health needs, the one that set the agenda. So again, we go back to the need to have a strong leadership from PAHO and help the countries to define their policies, own the policies, and also align and harmonize the other foreign aid or foreign assistance agencies.
Thank you, Lucrecia. I think what you're saying is extremely important, and we were going to talk about PAHO as an institution, as an organization, now that we've talked about the health challenges. And you said something about, not having the same recognition for the organization. And clearly during the pandemic, there was criticism about, initial response, how, PAHO was able to represent or not represent the region, how the revolving fund was not, used from the very beginning. And now the discussion is, how can PAHO, strengthen the position? And you talked about finances. We also heard, the problems with, the Trump administration decision to pull out from WHO and the probability of, having a knock-on effect on PAHO. So let's talk about PAHO as an institution. Let's talk about, the main challenges the institution has. You mentioned a few. You mentioned leadership. You mentioned legitimacy. You mentioned financing. What else can we prioritize and talk about? Francisco, do you want to address this one? You've been from the inside, so you can tell us, how does it feel to to see these these criticisms and what are the realities of the organization at the moment?
No, I think that Lucrecia touched critical points that PAHO will have to address, and the director will have to do a lot of changes probably to make sure that PAHO can really come back again to the level that the countries are expecting PAHO to be there. I agree with Lucrecia that, and I listened from many colleagues around the region, that PAHO was kind of absent during the pandemic. So I think that was something that happened. And also, all these changes with COVAX and the revolving fund and how all this evolved, trying to go through COVAX for the vaccines, and then every country started doing bilateral agreements. I think that had a negative impact on what PAHO could have done, because the revolving fund was supporting in the delivery of the vaccines only. It was not responsible for the acquisition of vaccines. But now PAHO has access to some vaccines through the revolving fund. Now they're procuring vaccines for COVID. However, that's one of the many problems that we have seen, Javier. And I think that the budget is going to be critical for the new director. Why? Because we are in a global financial crisis that we have seen that the economic impact in the countries in the region has been very, very, very strong. So how our country is going to be able to respond in paying their quota and to make sure that they can move forward with the organization. The good thing is that this year is a sanitary conference. So for member states to vote, they would have to make sure that they do some payments and they're not owing the organization a few years back. So some money is going to come into the organization, and that will help. The other good thing is that WHO is going to be increasing the region of the Americas PAHO quota for this year, so that between PAHO's quotas and WHO quota that PAHO is going to be receiving, we're going to cover more or less about 47% of the budget for the end of the biennium. So that's good. However, if member states do not come forward with their payments, we're going to be seeing some issues there. Because that is the budget for salaries, that is the budget for day-to-day business of the organization. I agree with Lucrecia that when you start depending on outside monies, is PAHO's priorities or is the funders' priorities the one that we're going to be working with? So hopefully, in my experience is that we try to match those two things together. There's always problems in the region, as I was saying. Health problems in the region are so wide and so many that when you don't have allocated money from within the regular budget, you try to look and find some monies outside. So if you can have a match of a PAHO need and the country's need with a funders, that's great. But when you can have risks if you have some money dictating what you have to do. And I think that's an overall discussion that has been going on with WHO and PAHO within in terms of who dictates the agenda. And non-state actors, we have to make sure that they do not dictate the agenda. Then we are, within PAHO, we have been losing, so to say, a lot of advisors because of age and retirement. The pandemic probably didn't help the organization to the renewal of a lot of new advisors. So that's one of the main reasons that within PAHO, they're going to be losing a lot of advisors with knowledge of the organization, with knowledge of the programs that they were working with for many years, and they're retiring or retiring close to retirement age. That's going to have an impact in the organization way to respond, because they're going to be bringing new people that will have to learn PAHO's way, and probably they will bring new ideas, but in the interim, while they go running and take the train before they leave the station, there's going to be a lot of issues there that are not be addressed in the proper way, because PAHO will have lost some people there. In a 120 years organization that PAHO is this year, the 123rd day, there's a lot of issues in terms of, for instance, one of the most beautiful buildings in Washington is the PAHO building. And it's a building that has over 50 years of age. So it needs renovation. That brings another issue, because after the pandemic, it's going to be reopened again for the conference. So the renovation of the building is going to demand some money. But also, what's going to happen in these economic issues in the countries when we are seeing 8 to 10% inflation rates in a region? The impact those inflation rates, being in the United States, in expenditures, in electricity, in contracts, everything, that's going to take a burden. Is the organization ready to make financial adjustments to this economic scenario that we're going to be facing? Of course, all these issues put together with all the health issues around, it's a mixture that the new director will have to steer to avoid those stormy clouds and waves that we're going to be seeing in the near future. It's going to be challenging, yes, but I think the organization has the opportunity to come back again to what it used to be, or to put the name again with bright lights and say, here we're back again, and we can support the member states. But remember, member states are the ones that dictate the priorities. Member states can demand PAHO to move forward and to step again to what they were doing before the pandemic. So I think it's up to the member states to demand the new director to do all these things and to move forward. Javier.
Thank you. We're getting to a long list of challenges for the organization itself. Fernando, you are, of course, the ambassador here in Washington. And of course, I think a lot of what Francisco said might resonate with how decisions are made at the country level and how, member states will determine, the future of the organization. What's your view on the challenges and your experience with, dealing with PAHO during the pandemic and in these past couple of years?
Thank you. I believe Dr. Hernandez wanted to jump in. Javier, I don't know if Dr. Hernandez, I believe you raised your hand.
Yes, I did, but go ahead because
okay.
I've spoken more.
Okay. Well, no, I would like to say in general, Dr. Guzman, that of course, Dr. Becerra is absolutely right, and also Dr. Hernandez and I want to remember or to recall what Dr. Carissa Etienne always used to say in our ministers of health assemblies. I mean, actually, we are all PAHO, and we all decide where PAHO should go and how to get there. And I do agree with Dr. Becerra that the hardest part is to actually agree in some specific points. But I have to say it at the same time. In the past, we all agreed to reach universal coverage, for example, in our region, and we haven't been able to get there. It's amazing after many years. Or, for example, and I also do agree with Dr. Becerra. It's not only the money PAHO received directly as is the money each country invests in our own people in health, especially in public health. There is a recommendation that we should reach at least 6% of our GDP as a general recommendation. Of course, it's not a matter of reaching a specific level. More recently, we all recognize that could be better to slow down those changes at least to increase 1% and to focus that 1% in primary care, for example, in all of our countries. But it's becoming something really hard dealing with the pandemic. And you said, or trying to answer your question, Dr. Guzman, the healthcare system with based on third level big specialized hospitals didn't perform properly if they didn't get these basic primary care and prevention programs ongoing. So that tells or show us a way to go. Definitely, PAHO should analyze or to consider continue working with nonprofit organizations, for example, and even the private sector, if they agree in the road and they share the same goals. And of course, we have to remember that because someone is paying the musicians, they are not going to choose the music they are going to play, and that is something very, very hard. And I do agree with Dr. Hernandez. I mean, we should be careful who's paying and what are really they paying for. But PAHO cannot pay everything, cannot deal with everything alone. And And I will have to mention, we should work in a better way with some other international financial or organizations, multilateral financial organizations that we have in the world and that we have in the Americas. But trying to remember that the technical expertise or the technical capabilities are in PAHO, and PAHO should lead the way. In that sense, Dr. Hernandez is completely right. The new director should be someone who's going to be able to do that, to deal with all these problems, and to become a real leader in the whole continent in health. I'm just going to put a short example. I just mentioned that traffic, road accidents, it's a public health problem, you name it. And for example, insurance companies doesn't want this to happen as a real thing. We should work closer with in private public partnership to find a way in which areas we can work together without losing the mandate that PAHO received from these ministers of health assembly, for example. And well, of course, resources are very limited. We should introduce health technology assessment techniques to be able to improve efficiencies in the way we expend or we invest the limited resources we have in health, for example.
Thank you. You've taken us through a long list of, possibilities and needs, not just at the, PAHO level, but at the country level, and how it is important to, maximize the benefits that you get from the money invested, and how, investing into, health systems and primary healthcare is key. Lucrecia, you wanted to say something before Fernando jump in. Do you want to go ahead?
Yeah, sure. Yeah, I don't agree very much when Francisco says that the massive retirements that PAHO is going to see in the near future, of course it will affect, but it has to be seen also as an opportunity. And I have a long list of things that I would like from the new director, but I'm going to prioritize. And I'm saying this, that the massive retirements can also be an opportunity for reform. We cannot postpone PAHO's reform anymore. And it's not just about reorienting the organization's efforts, it's about reorganizing its structure and function so that its technical assistance can be really effective. Very often we see PAHO promoting integral approaches of health, but its organization completely contradicts this. You see PAHO's organizational chart, it seems to be based on vertical programs and some improvisation, really. And the problem with vertical programs is that they come from different views and approaches. Some deal with phases of life, of course, like infant health or health for the elderly. Others do work with specific diseases like HIV or tuberculosis. Others are about specific social groups like migrants, workers, or indigenous populations. Others deal with transmission, like waterborne or vector-transmitted diseases. And others deal with dimensions like mental health or reproductive health. So, everything is quite confusing when you see the organizational chart of PAHO. And it is very difficult sometimes to understand what health topics or process belongs to. And if you add at the country level that PAHO has to work with other UN agencies like UNFPA, UNICEF, or FAO, then it gets even messier for the national health actors. So the thing is that we do need the reform and not just the reorientation of the institution. And we also need to see country offices strengthened, not only the headquarters. We need not only international staff here at the country level, but especially we need local staff being, educated and strengthened and solidified so that we have a built local capacity here at the country level. And this can be more budget friendly, to have local staff instead of having international staff. And this, of course, does not mean precarious work for local staff or consultants. On the contrary, PAHO should be working for if PAHO is working for the right to health, it has to do it at the same time when guaranteeing working rights and abide by national laws, by national working laws. So I do think that, we do need some reform. We do need not only restructuring and reorganizing, and also something that is very needed at the local level, and I think Francisco mentioned it before. The ministries of health not only need assistance with health policies and health planning, but also need strengthening of their institutional operation. And this means getting help for building skills and competencies for planning, defining budgets, how to manage human resources, monitoring, supervising, according, of course, to the country's public administration norms and laws. Because if we want to formulate and implement health policies, we also need competent and healthy public institutions. And we would like to see PAHO working and helping with these issues too.
Thank you, Lucrecia. You brought up the issue of reform, and I think Francisco wants to comment on that. I think it's a very important point. I mean, what exactly do we mean by reform? Because reform is, used as a general term, but is it possible? What exactly do you want to change, Francisco? Over to you.
I think that, I think that's Lucrecia touched on very, very key points. I think that strengthening health system is not only thinking on medical equipment or more physicians or more nurses. All the administration, bylaws, programs, and legal framework is part of the strengthening. And I think that it's something that PAHO has not been working in a stronger way with member states. And I think that's a great opportunity to start doing so. But I think that the reform, breaking from this traditional top-down structure with programs and all that, and when you start pushing one of the resolutions and everybody embarks in universal health coverage, we tend to forget that we have to see this in a matrix way. If PAHO doesn't start working in a matrix way to make sure that everything and everybody talks to each other within the organization, try to make the best out of the work in member states, trying to make best to understand that universal health coverage, you need the health system to deliver all the programs. And if they don't speak to each other, then you're going to be seeing what Lucrecia is saying. You're going to be silos, you're going to be vertical programs, which is not the way to go in the reality of the member states. When you have one physician in a health center somewhere in a rural area, he or she has to deal with all the programs that they have to work with. So they have to do immunization, they have to do NCD detection, they have to do HIV detection, they have to do everything. And they don't put a hat for each program. They're integrated healthcare. And I think that is something that we were having, and probably PAHO was also causing some issues when discussing how to approach universal health coverage, how to approach the key programs that are needed. And some ministries will think that it has a vertical program again. And we don't need more vertical programs. We need integrated programs, and PAHO has to start working in a more matrix way to change this vision that we're going to bring to the member states at ground level. And I think that that's also the part of the reform, Javier. And of course, make use of those member states that have stronger capabilities to support member states with weaker capabilities. And I think that this is also key. But also, Lucrecia mentioned other UN agencies. Rather than fighting for this is my niche, or I don't come into my niche because it's mine, I think that there should be more UN to UN agreements to work together because we're working for member states. When you work at the UN system, you're working for the member states. They are the owners. They are the ones who dictate you what to do. So I think that we have to listen to the member states. We have to have agreements with other UN agencies and work together at the field level to improve the health conditions and try to reach SDGs, because 2.5 years of pandemic, I can bet you that all member states are way back into trying to achieve SDGs. And I think that's a crucial issue. Time is running. We barely have 7 years to reach 2030, and I don't think that we're going to be reaching all the objectives and goals that countries set for SDGs. But also there's a key issue that PAHO new director is going to be facing, Javier, and I'm seeing a comment that Ambassador Jimmy Cotter placed about the repercussions of mice medicals. And I think that's kind of the elephant in the room that everybody knows is there, but nobody's talking about. And I think that it's something that at the end, the new director would have to face the legal issues that the organization is going to be facing because of the legal suit that some Cuban physicians brought against the organization. We don't have all the details. We don't go into those issues right now, but it's something that PAHO is being affected reputational, and they will have to work very strong to give the face and come out clean in that regard. Javier.
Thank you. Fernando, do you want to comment on the question of reform? Do you think reform is needed, or is it just more of a, reorganizing what's already in there? Because I think the matrix organization that Francisco was alluding to is doable with the current, organizational structure. Is it about reform, or is it about a better use of resources? Well, what is your take on the reform?
Yes, of course, there is a lot of room for both in some way. I mean, we cannot continue working the way we've been doing it, working in isolated. Sometimes, some other times are very well integrated, but isolated programs or focus on specific projects. Which is good, but we cannot forget that that kind of organizations reduce the chance to react to something new, to change, and we should become more flexible and definitely it's very important to reform the functional process we are actually practicing right now. But it's not only, again, the way PAHO works, is the way the countries perform in their own, and how they take advantage of the PAHO options they may share with each country in dealing with the specific situations. But the pandemic showed us a good example of how epidemiological surveillance is a national, regional, and global security affair, and how the countries report new cases, and how in the end that affects us all. We should change the way we collect many of this information. We should improve the technical procedures on that, and we should reduce the political interference on those processes, because sometimes countries doesn't want to be stigmatized because they are facing a problem, and they don't report as quick as they can or as quick as they should. it's just because they are afraid of being stigmatized, and we cannot disconnect this with the whole economy. For example, if a country depends on tourism, for example, if they are facing a hard time because they are being stigmatized, their situation is going to become worse because probably the country is going to be closed. And so we should change that from a negative point of view of reporting, of sharing information, for example, to a positive or a better one, trying to PAHO should be this organization that once a country is facing a huge problem, should be the one who help that country in a quicker and in a better way first. And there is a lot of room to introduce reforms in the way, just to mention an example, the way we collect data, we report data, we share that data to the world, and we make it that process as a transparent one. It's hard to not to avoid that most of the countries, for example, doesn't really get a system of health account, for example, a national system of health account. And that is something really, really amazing nowadays. I mean, PAHO should promote in a better way that every country should have it, and that those data should be transparent to all of us, and to recognize their own situation, for example. So yes, there is a lot of room for reforms. What Dr. Becerra mentioned is a real thing. I mean, human talent need to be replaced once they reach the time to realize that they must leave the organization. And we should make sure that the new human talent that we should have, not only in Washington D.C., but like Dr. Hernandez already said, in locally in our own countries, should be the best. Please.
Thank you, Fernando. I think the question of pandemic preparedness and surveillance and reporting and the role of PAHO is going to be very interesting to see whether we, the Americas, behave as a region, and we see the trend from centrally run institutions to regional conversations, and the regional conversations in terms of surveillance, but in terms of manufacturing, but in terms of the RNA, mRNA hubs, for instance. One big question there is: do you think we are or will behave as a region better? Is the conversation about the pandemic treaty, for instance, is clearly something that the region could act as a bloc, or do you think we're still far from being able to behave as a region? And what's the role of PAHO in that conversation about being a region? Anyone wants to go ahead with this conversation on pandemic preparedness?
That's going to be difficult. We have seen that even having the international health regulation, having all the things that work as a region, this Americas region, we have been always working together in a lot of programs in a lot of ways. But we saw in the pandemic that countries were taking their own decisions, thinking on their own national security. And when you put national security up front, everything goes out of the window. So that's going to be very difficult, especially during the pandemic, when the key country in the region, the United States, started making their own national security decisions. I think that all the other countries were following suit. And I think that you could see that Mexico was open to all the travel, but Argentina was close to all the travel. So you could see the whole difference where decisions were made. Some of them following the international health regulations, some of them were just totally ignoring it. So it has been difficult in any kind of pandemic threat or real pandemic to really face and act as a region, because countries put their interests first and most up front. But let me close probably one closing remark. When I came into the organization and tried to make some changes, people would tell to me, but this is the way we have always been doing this. My answer was, it doesn't mean that there are not other ways to do it and have the same success. And I think that's going to happen, and that's the opportunity for the new director in PAHO. Not because they have been doing things the same way for 120 years means that they cannot change and do things better. Javier.
Thank you. So you said something about the difficulties in behaving as a region, but I can clearly see how member states do demand, a PAHO that is strong, a PAHO that is technically sound, a PAHO that is, able to activate the assets that we have as a region, the strategic fund, the revolving fund, how we want the PAHO to basically provide technical assistance on surveillance. So I guess it might be that we will not do all as a region, but there will be certain functions that are critical for PAHO to lead. So we're coming to an end. I'm just going to give you all, the opportunity to make a brief concluding remark. So what is, if you could just give one, advice or one, high-level recommendation to the new Director General of the Pan American Health Organization, what would that be? And who wants to start first? And any other concluding remark, please, is your opportunity. Lucrecia, do you want to start?
Yeah, I think that the main thing that I would ask from the new director is leadership and courage. To lead, to strengthen the organization at country levels, to reclaim PAHO's role as a major player in the global health community or in the regional health community, and to be brave in terms of trying to reorganize or reform the structure, because we are dealing with a different health situation now, very different from the ones, 15 years ago, 50 years ago. So we cannot keep doing the same thing. We need to change. We need a PAHO that is more effective, that really sets its agenda because or by the national or country's health needs, and not from other donors or funders. So yeah, I think that leadership will be key for PAHO to survive and thrive.
Great. Leadership, courage, positioning. Francisco, you want to go next?
Thank you. Be bold, be courageous, exercise your leadership, surround yourself with people who can guide you as an external advisory board that can really support you. Listen to member states and start doing those changes as soon as possible. 5 years for the first term sounds a lot, but time flies. So you have to work fast. Thank you, Javier. Thank you for the invitation.
Okay. Fernando, you want to give your remarks, your advice to the new Director?
Well, I wouldn't say it's an advice, but I would love to see someone trying to really innovate in the organization, to introduce changes, to be creative, and to be able to lead those changes to something better. There's a lot of work to do. I truly wish them luck to all the candidates, but we all need PAHO, and not only in the Americas. I have to say the leadership of PAHO as an institution, as an historical institution, it's beyond the Americas, and the whole world need a PAHO, a strong PAHO, and a better PAHO, and I'm sure we can get there if we really focus on that. So good luck to all of them on that, and of course we are ready to help always.
Great, thank you. Well, it's been a pleasure to have you all here. Thank you very much for participating in this conversation. We here at CGD, we will follow the election closely. We will be, coming up with materials and coming up with commentary. But it's great to close on, a positive note that it is time for, a new chapter. It's time for repositioning. It's time for, leadership, courage, trust, and working together to get a stronger, better PAHO going forward. Thanks to you all three, and thanks to our viewers. It's been a pleasure. Have a good day. Bye-bye.
Thank you. Goodbye.